Here we have radiograph on a 70-year-old with history of ongoing left wrist pain. No history of trauma is provided in the clinical history. This patient has come from primary care, so how do we report it and how to proceed? So first, let's describe the radiographic findings. AP and lateral views, so there is no previous imaging for comparison. So I would describe the abnormality as follows. There is a transverse fracture through the distal end of the shaft of the radius, not involving the articular surface. There is a sclerosis on both sides of the fracture line with some callus formation on the ulnar aspect. There is no displacement or angulation. Features are hence consistent with an old fracture. This fracture line appears to be fused on the radial half and still appears to be open or seen on the ulnar half. Hence, the features are suggestive of partial union. However, I would recommend CT scan of the wrist for further evaluation to assess if there is a non-union or delayed union. I would ask the primary care referring physician to refer to orthopedic team for further clinical evaluation. So in summary, we have got a case of an old fracture with partial union which needs further evaluation with CT scan and orthopedic team.